Hey everyone, this is Dr. Afshan. Today I want to show you a full veterinary checkup on a stray kitten I found outside while I was just out buying a coffee. The moment I picked him up, I could tell something was wrong. His eyes, his breathing, his posture, everything pointed toward feline herpes virus, one of the most common infections we see in stray kittens. First, I start with the eyes. Herpes in cats usually show up here first. Watery discharge, redness, and thick mucus. You can see the buildup on his eyelids, especially on the right side. Eye care in herpes kittens is extremely important because untreated infections can lead to serious complications. Next, I move to the nose and breathing. Herpes often causes congestion and sneezing, so I'm checking for crusting, nasal blockage, and listening to see if his breathing sounds strained. A congested kitten can't smell food well, and if they can't smell, they usually won't eat. Now I'm performing an auscultation, listening to the heart and lungs with the stethoscope. I move across different areas of the chest to check for heart murmurs, irregular rhythms, increased lung sounds, fluid buildup. Kittens with herpes can develop secondary bacterial infections, especially in the lungs, so auscultation is crucial to catch early signs of pneumonia or respiratory distress. Thankfully, his chest sounds fairly clean, which is a good sign. Here, I'm palpating the lymph nodes under the jaw and around the neck. With viral infections like herpes, these nodes often swell as the immune system works over time. It gives me important information about how active the infection is. I take a quick look inside his mouth to assess hydration, gum color, and check for ulcers or inflammation. Dehydration is extremely common in sick kittens, especially when they're too congested to eat or drink properly. Now I'm gently palpating the abdomen. I'm checking for discomfort, bloating, or enlarged organs. I also feel the kidneys to make sure they're normal in size and not sensitive. Kidney pain can tell me a lot about dehydration levels. As you can see, his right eye is especially inflamed, so tracking his progress will be important. The next step is to weight him. He's about 500 grams, very small but still within range for his estimated age. To test his appetite and energy, I offered him a creamy kitten supplement, and as you can see, he absolutely loves it. A strong appetite in a sick kitten is one of the best signs we can hope for. When a cat stops eating, what we call anorexia, it usually means something much more serious is going on. As expected, this little guy has feline herpes virus or FHV1. The good news is that with proper care, most kittens recover well. His treatment plan includes antiviral support, eye medication to reduce inflammation, antibiotics if secondary infections appear, fluid support if he stops eating, warmth, rest, and close monitoring. A lot of stray kittens never get this chance, but he does. If you'd like to follow his progress or want to see more POV vet cases like this, let me know in the comments. I'd love to share more with you.